Today, we're going to be talking about how to protect your hip cartilage if you have femoroacetabular impingement as a medical diagnosis. We're going to be looking at a paper that looked at the results of surgery for your hip cartilage and really bad physical therapy for your hip cartilage. So if you're ready, let's get ready to think right, move right, and feel right. This paper was published in 2021 and it was a randomized controlled trial done in Australia. I'm going to read to you from the conclusion. Patients treated with surgery reported greater benefits and symptoms at 12 months compared to PHT, which is the personalized hip therapy protocol, which I did a detailed video on and I'll link to at the end of this video and in the description box. In short, it's a really crappy physical therapy protocol that is designed to fail, but these benefits are not explained by better hip cartilage metabolism. So this study actually looked at 99 patients and it said, all right, half of you get surgery, half of you get physical therapy. And the physical therapy, like I mentioned, is terrible. What's unique about this study, though, is that they looked at the state of the cartilage in the patients so they could see, is the cartilage better, is it worse? If you believe the standard conventional wisdom from orthopedics that hip impingement is going to lead to cartilage damage, then you would expect that if you do the surgery, the cartilage will be in better shape after the surgery. You're going to see that at 12 months, people who got surgery have better cartilage, and people who didn't do the surgery, the people who did the really crappy physical therapy protocol, are going to have worse cartilage. So let's just jump into table 4, which shows us the state of people's cartilage after 12 months. At the very top of the table, they show change across all regions, excluding within grade changes. So that basically means changes in a negative direction that actually result in somebody getting downgraded. So let's say you're at grade 1 in terms of your hip cartilage, then if you get worse and then you go down into grade 2, that's going to be picked up in these numbers. This first part of the table is excluding smaller changes. So if you're in grade 1 and you decline a little bit, but you're still in grade 1, it's not going to show in these numbers. That's in the next part of the table. So when we look at the physical therapy group, the group that did terrible physical therapy, they showed that 100% showed absolutely no change. No worsening in their hip cartilage, no grade changes going down. In the hip surgery group, 69% showed no change, but 31% showed that their hip cartilage was worsening in at least one subregion. So let's be very clear about that again. The physical therapy group, even though they were wasting their time with a horrible protocol with physiotherapists who were probably telling them that they needed surgery, they had no significant worsening in their hip cartilage after 12 months. But what about smaller changes? Maybe the people in the physical therapy group were having a lot of smaller declines, so maybe all of them are showing smaller declines but not grade changes, and maybe it's kind of a fluke or something. Well, if we include those smaller changes, then a whopping 5% of the physical therapy group showed some signs of worsening. So that means 5% showed a smaller decline within grade. And in the surgery group, 38% showed worsening. So that means if we include the smaller changes, the surgery group does even worse. So now you might be thinking, wait, I thought hip surgery is supposed to protect your hip cartilage. Why would all these people who got surgery have their hip cartilage in worse condition after 12 months? That's exactly what I was thinking. Then we're all on the same page, because if you believe the standard orthopedic model, then this shouldn't happen and you shouldn't see such a dramatic difference between the two groups. If anything, you should see these things flipped and you should see that the surgery group has better cartilage, but you clearly don't. This reminds me of the whole saga that orthopedics has gone through with knee surgeries, where they said, you know what, to prevent future knee arthritis, we got to operate on your knee. But then they started to realize that when they did that, it generally would progress to needing a full knee replacement because your knee would just get worse over time. And of course, there's also that research that shows that a lot of knee surgeries are no better than just fake placebo surgeries, but orthopedics still keep doing those knee surgeries. It's almost as if the scientific research doesn't really matter in orthopedics. Which actually brings me to Appendix 3 of this paper, where they mentioned they had trouble recruiting patients for this study because Australia's Medicare system stopped paying for surgery to fix FAI due to a lack of scientific evidence that it works or that it's appropriate to treat people's hip pain with this surgery. Australia's Medicare system made that decision back in 2016 after looking at the total lack of evidence that surgery for FAI made any sense or was effective for patients. And a study like this one shows that they made the right decision. If you're giving surgery to people to prevent damage to their hip cartilage and it's causing more damage to their hip cartilage, then you have a problem. Of course, in this study, they used the IHOT-33 questionnaire to determine whether the people who got surgery improved and got more symptom relief versus physical therapy. But in the previous video, I debunked the IHOT-33 and explained how it is biased to show improvement in the surgical group. If you want to watch that video, I'm going to link to it in the description box and at the end of this video. And if you want to understand why the PHT protocol, the physical therapy protocol they use in this study is total garbage, I have a detailed video on that I'll link to in the end of this video. In summary, if you want to fix your hips, it is my strong non-medical belief that you should ATM always think muscles. Even if you're consistently doing the wrong thing like they were doing with the PHT protocol, you don't see hip cartilage damage, and there are studies that show that the bone shapes never lead to arthritis or damage to your hips. They have done studies where they follow people for 18 years and it shows no correlation between bone shapes and the development of hip arthritis. They've done studies where they look at old senior age athletes and find that FAI bone shapes have no connection to anything. And this study shows you that when you get the surgery, you damage your hip cartilage. So if you want your hips to be healthier, you need to move them and start training the muscles so that everything works well again. If you're looking for a way to help your hips, go to uprighthealth.com/DIY so you can rebuild your healthy hips. To find out how surgeons use the IHOT-33 and PHT protocol to make hip surgery look better than it really is, check out these videos here. To support this channel, use the donate link you'll find in the description box or use the join and thanks buttons on YouTube. Like, share, and subscribe with the bell notification on, and as always, I hope you remember that pain sucks, life shouldn't.